Hello, my name is Dr. Hillel Mazansky. I specialize in medical hypnosis, guided imagery, nutrition, and exercise. My website being drmedicalhypnosis.com, drmedicalhypnosis.com, from which you can purchase your specific healthcare hypnosis videos. Today's health tip is entitled Hypertension, the Silent Killer. Hypertension or high blood pressure is exactly that. It is an extremely common condition. And what the hypertension really means is that the pressure of the blood against the arteries are raised, giving rise to the blood pressure. There are two numbers in the blood pressure. The first is the upper number, or the systolic, and then there's the lower number, or the diastolic. The systolic should be 120, and the diastolic should be 80. Men usually get hypertension around 45, and both females and males get hypertension around 65. The reason why it's called the silent killer is because one does not feel that they have high blood pressure. They don't feel ill, they don't feel sick. But ongoing high blood pressure has serious consequences in that it can damage the heart, and the heart goes into heart failure. It damages the brain, and you can get a stroke, and it damages the kidneys, and the kidneys go into failure. Now, the main source of the salt is our food. And the FDA suggests that we do not eat more than 1,500 milligrams of sodium a day. Foods such as prepared foods, soups, breads, and deli foods all contain high amounts of salt and should be avoided. In patients who do have hypertension and still would like to have the salty taste, you can have low sodium or no sodium salt, or kosher salt has got less sodium in it, or a substance called Mrs. Dash, which is a whole different conglomeration of different spices, which when you put it on your food, it tastes like salt. You don't take one reading and say you have high blood pressure. You have to have at least 3 or 4 readings at the same or different types of the day, and write down the number to make sure that you do in fact have hypertension. And if you do, it's necessary to go to see the doctor. There is a condition called white coat syndrome, that because the stress and anxiety when you go to the doctor, that in itself can raise your blood pressure. Some doctors don't wear white coats for this reason. Anxiety and stress in of itself can also cause ongoing hypertension. When it comes to foods, we fight hypertension with food first. It's called the DASH diet. dietary associations against hypertension and salt and hypertension. And that type of diet consists very similar to the Mediterranean diet, where there's high fish, some olive oil, a lot of fruit and vegetables, all low sodium, of course, freshly prepared, nuts, and no prepared foods at all, because they contain the salt. Then, of course, you don't add salt on your food, as I mentioned. Excess alcohol intake can lead to high blood pressure. Taken over a long time, excess alcohol leads to hypertension. Caffeine, however, does not lead to hypertension. For many years, it was thought that caffeine causes high blood pressure, but it's not. If you drink caffeinated coffee, you might get the jitters or something like that. But if you drink decaf coffee, you will not get hypertension. So the first thing in the treatment is the DASH diet. The second thing is exercise. Cardiovascular exercise done 6 days a week can definitely help reduce the high blood pressure. The third thing is weight loss. You losing weight to a substantial amount that you are reasonable in body habitus, those three things can lower your blood pressure, and you do not need medication. However, in the unlikely event that using those three modalities of the DASH diet, the exercise, and the low sodium do not achieve a low blood pressure, then there are a whole variety of different types of medications that your physician can use. Basically, it's a diuretic to get rid of the blood, to get rid of the excess fluid, which lowers your blood pressure. There's the beta blockers, which keep the heart from beating fast. There's the ACE inhibitors, which have an effect on the kidneys, and so on and so forth. Your doctors will tell you what you can do. But how can we help you now with hypertension? If you are stressed out, we have a special video and hypnosis session that deals with stress. And either you come to the office or you get our video and you listen to the stress video twice a day, and you'll be amazed that by following our nutrition advice on the video, our exercise advice, and listening to the video, the stress, decreasing the anxiety and stress, you'll be amazed at how your blood pressure will decrease and why take medication with all the side effects. My name is Dr. Hillel Mazansky, and I thank you for listening to the video.